Hello friends, in the current video I am going to explain about the topic of hypertension and what are their causes, symptoms and management. So let's begin. What is hypertension? Hypertension, also known as high blood pressure. In common language we know it as high blood pressure. It is in medical terminology it is known as hypertension. Is a common condition that significantly increases the risk of heart risk, stroke and other serious conditions. Means hypertension is a common condition because of which most some people can there are chances that those people who have hypertension they can develop heart diseases, stroke and other serious conditions like brain hemorrhage, cerebrovascular stroke or renal failure. These all the conditions can develop in the patient who are having high blood pressure, which is also known as hypertension. And what is hypertension? Now we will see what is hypertension. Hypertension is the force of blood against the artery walls. Whatever the arteries are present in the human body, what amount of pressure, what amount of pressure, perpendicular pressure blood is showing on the wall of the artery is measured and is calculated, and that is known as a blood pressure. If it is more than the certain than the normal value, then we call it as hypertension. And it is measured in two numbers. We measure hypertension in two numbers. One is systolic hypertension, another is diastolic hypertension. We will in the next slides we will study, we will understand also about what is systolic and diastolic pressure, which is a key value which is used to measure the blood pressure in an individual. Now we will see here what are the types of hypertension. Okay, there are two main types of hypertension. One is known as primary essential hypertension, which is known as primary or essential hypertension, and another is secondary hypertension. So let's come to see epidemiology of hypertension. Means how many people in the globe, how many it affects, how many how much of amount of people. So that we will study in this epidemiology of hypertension. Hypertension is a global health concern because in every country, every state, we see patients who are having hypertension or high blood pressure, which is affecting millions of people worldwide. It affects millions of people worldwide, and in India around 1 in 3 adults suffer from hypertension. In India 1 in 3 adults suffer from hypertension. It's a ratio. By that you can understand how many people suffer. If in a family there are 6 people, then two people, generally 2 people have hypertension. Now we see what are the risk factors of hypertension. When if in these conditions we can say that there are more chances of these individuals have high blood pressure or hypertension. Those are age. Because of increased age, there are chances that individual develop hypertension. Genetics, if it is present in their family, their parents, grandparents or elderly people, brothers, sisters or cousins, if they are having a history of hypertension, then there is a chance that those other individuals also develop hypertension. And obesity, if a person is not taking care of their health, their BMI, not taking care of their lifestyle, and they have increased weight, then and they are obese, then there are more chances that they are hypertensive. And lack of physical activity. If people are not doing physical activity, they are having sedentary lifestyle, they are not doing exercise, they are not going for walking or other um, activities, then gym or other physical activities, then there is a chance that they develop hypertension. And high salt diet. If any individual they are taking, because salt plays very important role in deciding the hypertension of an individual, blood pressure of an individual. So if there is intake of more amount of salt, then it proportionately increase the pressure of blood on the walls, and and it will result in hypertension, because of high sodium content in the blood. uh, it will develop high pressure, and in turn it will develop hypertension. And smoking is also a risk factor for hypertension. If an individual is having a habit of smoking, then there is a chance that they show high blood pressure. Alcohol consumption, simultaneously alcohol consumption is also a risk factor of hypertension. Those individuals who have a habit of alcohol consumption, it is shown that they show a high blood pressure, or they are diseased of hypertension. Then what are the symptoms of hypertension? Common symptoms of hypertension include these points, these things. Symptoms means those, what are the things we can see in the patient. Both it can be it can be observational complaints, or it can be verbal complaints. So these symptoms come to the notice of clinicians, that they show they get severe headaches and fatigue or confusion. Fatigue and confusion. They have vision problems, and they give complaint of chest pain, because it it is related to the blood pressure, and heart pumps the blood to all of the part of our body. And so because of increased hypertension, it's directly or indirectly the result of cardiovascular symptoms also, and it will radiate to chest pain and difficulty in breathing. They will show symptoms of difficulty of breathing. These all are the symptoms which is the main problem of people who are having hypertension. That is, because of the high blood pressure, if they are having severe headaches, it shows that it is affecting their cardiovascular system. If they will have fatigue and confusion because of their obesity, because of their lifestyle, and because of high blood pressure. It will also affect their heart, and it will affect their respiratory system, and it will also, as it is affecting their cerebrovascular system, because of all those things their metabolism get affected, and because of that they show the symptoms of fatigue and confusions. And visual problems, because those people who have high blood pressure, they also show the symptom, they also have complaint of decreased vision and chest pain, as it is related to the cardiovascular system, and the force at which the heart is pumping the blood, uh, and difficulty in breathing. In the most severe cases, it will also affect the respiratory system of the individual. So because of fatigue, and because of poor functioning of the cardiovascular system because of hypertension. And hypertension, they also develop difficulty in breathing because respiratory system also get affected because of hypertension. Now we will see what are the complications of untreated hypertension. If these are complications means what will happen if a patient who is having hypertension don't get proper treatment or don't get stay unattended, then what complications he may develop. So the first and foremost complication is stroke. It can be cardiovascular stroke or cerebrovascular stroke, because it happens because of the high blood pressure on the brain. uh, there can be there can be hemorrhage in the brain because of rupture of blood vessels because of hypertension. So then will result in stroke, heart attack if it affects their individual's cardiovascular system because of untreated hypertension. Kidney damage, it also affects damage, vision loss, and if heart attack is not attended, it may result in heart failure. Now how hypertension is diagnosed. So now in this slide we see that how hypertension can be diagnosed, and early diagnosis can result in early treatment and prevent in the prevention of complications. So hypertension is diagnosed through regular blood pressure monitoring. So every individual, so they should monitor their blood pressure regularly, and sometimes additional tests like urine test, blood test, and ECG also can help in diagnosing hypertension in any patient. Now what lifestyle changes for management. So what in this slide we will see what lifestyle changes we can advise to the patient in their own. If they can do, it will help in reducing their blood pressure and treating their disease. So to manage hypertension, lifestyle changes are crucial, important, very important, because even after medication, even after all other treatments also, if obesity is not maintained, their lifestyle changes not happened, they are not doing exercise, it don't show that much effect, that it don't show that much effect on the individual, and it will not lead to the cure of disease. So these lifestyle changes are very important to adapt by the patient to do the management of their illness. That is healthy diet diet means they should take healthy and balanced diet, regular exercise, they do regularly exercise, reduce sodium intake, they should not take more amount of salt or sodium, limiting alcohol, and quitting smoking. They should not they should not drink, they should limit the amount of alcohol intake, and they should quit smoking. So these are the lifestyle changes which are very crucial to manage the individual's hypertension. If after giving medication also they are not adopting, they are themselves, if they are not doing these lifestyle changes, then whatever the medications and whatever the measures, other measures provided by the clinician, they may not show that much effect, and they may not show they may not result in cure of the diseases. So these things are where these lifestyle changes are very essential in the cure of disease. So now dietary recommendations. What are the dietary things we should advise to the patient who are having hypertension? Adopt a healthy diet rich in fruits. We should ask them, take a healthy diet, take more amount of foods in that, vegetables in that, and whole grains. You take low fat dietary foods. and reduce salt intake, include potassium rich foods. So these all are the dietary recommendations we should provide to an individual who is having hypertension. Now I will come to exercise and physical activities. Here what exercises, what physical activities we can tell the patient to do that do is that engage in a regular physical activity. We should ask them, you regularly you do exercise, you do physical activity like brisk walking, swimming or cycling for at least 30 minutes most of the week. At least 30 minutes of brisk walking, swimming and cycling they should do. This we have to say to the patients. And medication management, and what is the medication management? Various medications like ACE inhibitors, beta blockers, diuretics etc. can help manage the hypertension under doctor's guidance. So we can give ACE inhibitors, beta blockers and diuretics to manage hypertension. Monitoring blood pressure at home. Whoever the patients come to the clinic, we can ask them, you buy a BP machine. Usually nowadays it is available in every medical store. So we can advise them, if you can buy it. You regularly you check your BP. If you see any abnormalities, you can visit your doctor. We can advise them. Do and track your blood pressure trends and and it will ensure effective management of hypertension. Now prevention of hypertension. How we can prevent hypertension? If an individual is of early ages and he didn't develop hypertension yet, then what the things we can advise so that he don't develop hypertension in the next years of his or her life. Then we have to tell them prevent measures including maintaining a healthy weight. Preventive measures include maintaining a healthy weight. We should ask them, maintain a healthy weight, don't get obese, eating a balanced diet, have a balanced diet in the whatever the contents you are taking in your diet, whatever the things you are including in the diet, they should be balanced, and the quantity also should be balanced. Simultaneously they should do regularly, they should exercise, they should do physical activities. Individuals should not take more amount of salt. They should avoid smoking and alcohol consumptions. These all are the things that individuals should do if they want to stay fit for longer years and should not want to develop hypertension and their symptoms. Now here we will see a case study of an individual. A 50 years old male patient with a history of obesity and smoking was diagnosed with hypertension and successfully managed it through lifestyle changes and medication. It is a case study in which what happens that a 50-year-old male patient, he with a history of obesity, he was previously having obesity and smoking, and what happens that later on he developed hypertension. He diagnosed with hypertension. Then then next what happens to him, that successfully he managed it. How he managed? Through lifestyle changes. He did few lifestyle changes. He maintained his weight, he maintained his diet, he other measures also, he did physical activities, and he also took medications as per his doctor, and he managed successfully. So now we will see what are the myths and facts about hypertension. It means that in the society, patient attenders, their relatives in the society, they have a false thing they start believing. So we call it as myths of hypertension, and we will see what are the facts in that. Myth: hypertension only affects older people. There is a myth in the society that only older people they get hypertension, but this is not the case. The fact is that hypertension can affect people of all ages. If any person can develop hypertension. And now impact of hypertension on daily life. If an individual gets hypertension, how his life get affected? Hypertension can affect work, family life and daily activities, making it important to manage effectively. So it will affect their work, if it will affect their family life, it will affect whatever the activities they do daily. So hypertension need to be managed effectively, because if a patient is having hypertension, there is a chance that they are not having proper weight, they are not having they are having fatigue, they have sedentary life, they have other complications of the cardiovascular system, or they may develop other risk, other complications. So it will in turn, if it is not managed, it will affect the patient uh, life, and it will affect his work, family and daily activities. Now recent advances in hypertension treatments. So here we see what are the recent advances happened in the treatment of hypertension. New research and technologies have led to advanced treatments for hypertension, including new medications and personalized treatment plans. So in new research and technologies, what happened that advanced treatment for hypertension arrived. In that, what is included is that a few new medications and new personalized treatment for that particular patient came, so which help in the management of patients. So these are the main things, advances happened. Those are new medications and personalized treatment plans. Means treatment plans are personalized for every patient. It's not similar for all patients. It is as per the patient uh, condition and more particular about particular patients. Now thank you for your attention, and if you people have any questions regarding the topic, you can ask questions in the comment section. So let's review and whatever the thing we studied today, and we will see it. So we studied that hypertension is also known as high blood pressure. We understood in the introduction what is hypertension and what can happen if an individual have hypertension. We studied what is hypertension. We studied about systolic hypertension and diastolic hypertension. Here in this topic we did not get the slide of systolic and diastolic pressure. Systolic pressure is measured when heart pumps the blood, and systolic and diastolic pressure are the readings in which we measure what is the during the heart contraction we get systolic pressure, and when the heart is relaxed we measure the pressure, and we call it as diastolic pressure. We will study in the later videos about it. And what is hypertension? Hypertension is again divided into two types. One is primary essential hypertension, another is secondary hypertension. Now epidemiology, globally 1 out of 3 people suffer from hypertension, and it is a global health concern. And in the risk factors we saw that age, genetics, obesity, lack of physical activity, high salt intake, smoking, alcohol consumptions are the risk factors of hypertension. Then we studied what are the symptoms of hypertension. severe headaches, fatigue, confusion, vision problems, chest pain, difficulty in breathing, also also a symptom of hypertension. If symptoms means if a patient comes with a complaint of severe headache, fatigue or confusion, vision problems, chest pain, difficulty in breathing, we need to check the blood pressure of the individual, and we have to see whether the individual is having high blood pressure or hypertension or not. Then what can be the complications if hypertension stay untreated? The patients may develop a stroke, heart attack, kidney damage, loss of vision and heart failure. Then how hypertension can be diagnosed? How to diagnose hypertension? Hypertension can be diagnosed by regular blood pressure monitoring by BP instrument. Then it can be measured both digital or manual BP instrument, and other tests like urine test, blood test, ECG also can be used to diagnose hypertension. Then we studied about what lifestyle changes need to be done in an individual to treat hypertension. Healthy diet, diet should the patient should take, and regular exercise, reducing sodium intake, they should limit alcohol, and they should quit smoking. Then we studied about what are the dietary recommendation we should advise to the patient. We can advise to the patient, we can ask them to take more amount of fruits, vegetables, whole grains, low fat dietary products, and we should ask the patient to reduce salt intake and take potassium rich foods. And we have to ask the patient to do physical activities for at least 30 minutes in a week, so that and they maintain their healthy lifestyle, and we should ask them to do regularly. Then we have what we can give ACE inhibitors, beta blockers, diuretics, etc. to manage hypertension medically. And then we can ask the patients to track their blood pressure regularly to prevent further complications, and to prevent hypertension in an individual. We have to ask the patients that they maintain healthy weight, healthy dietary habits, reduce salt intake, do regular exercise, don't do smoking and don't do alcohol consumption. Then we studied about a case study of an individual who is 50 years of age, and how his hypertension successfully managed. Then we studied about what is the myth in the society about hypertension and what is the fact regarding it. Then we studied what is the impact if a person is having hypertension in their daily life. Then we studied what are the recent advances. We studied that in recent advances, new medications and new personalized treatment plans came to manage hypertension of the patients. Then okay, the end. Thanks for watching.